Okay, can you guys see my screen? Okay. I'll take that as a yes.
Yes, yes.
Stop me if you can't see it. Um, okay, so sorry. Okay. Um, Let me know if the slides aren't changing because I know that can happen sometimes. But basically, I wanted to first introduce myself. My name is Huda Khalif. I'm a pediatric ST2 at the minute, training in the Northwest London Deanery. I graduated from St. George's University of London, and I initially did my foundation training in Leicester before moving back to London. Um, so I'm going to be covering just about how the application process into pediatric goes, what you should expect, what you should look out for, and give you guys some tips on how to do well in the application process. So I'll cover a little bit about the structure of recruitment, how they use Oriole, and what the application stages actually are. And then I'll go into a bit of more detail about the actual application itself, the interviews, and then I'll show you guys some important resources because pediatrics is quite good at basically putting all the information out there and you won't like ever be tripped up basically. So just a quick disclaimer, like the current information I have is based on what they did for the 2024 recruitment. So I had a look at the website and resources and things like that, and this is what they did this year. Of course, you need to look out for what they might change. So around October, the RCPCH always do a webinar where they go through things from beginning to end and let you know how the process will be for the following year, basically. Um, Structure of recruitment. So the way it works is first you do an application form where you're basically given white space answers. So you basically ask a couple of questions and you just need to answer them basically. And the main questions are basically four. The main sort of categories are basically four. And essentially what you're expected to talk about is your past achievements, any clinical experience you might have, some governance things, so like audit QI, and then also the biggest sort of chunk is career motivation question. And essentially the application form is marked and you get a score out of 60. And then the interviews is basically a 30-minute interview. I think they might increase the time to 40 minutes, sorry, for 2024, but it's a 40-minute interview essentially covering four main domains, so covering communication, clinical reasoning, career motivation again, and reflective practice. And then essentially both your scores from the interview and the application form are put together with more weighting towards the interview, and then it's combined to basically give you the final national ranking score. So just about the actual application process itself. So you apply using the Oriole National Recruitment System. So for those of you who applied for F1 and F2, you'll know what that is. Essentially, it's an online system. It's quite easy to use. And the application window is essentially between early November to early December. You have to look out for the actual dates of when the application window opens. I would advise that prior to the application window opening, maybe in like September or October, you look at making yourself an account on Oriole and just getting used to the interface and making sure that you haven't got any issues with having an account. And then essentially, as soon as the application window closes in December, they go through a process of long listing. Essentially, that's just to check whether applicants meet the essential criteria that's outlined in the person specification, which I'll show you guys what that is. But essentially, the essential criteria is like your basic things like making sure you've got your degree, full GMC license, making sure that you finished F1, F2, or if you haven't, you've done something equivalent or have like a CREST form filled in, etc. It's just making sure you've got all the essential bits and bobs. And then it's also making sure that you don't have more than 2 years previous pediatric experience. So essentially, if you want to apply to the through the ST1 route, you have to have a maximum of 2 years You don't need to have any previous experience at all, but if you do have previous pediatric experience, it can only be a maximum of 2 years. Otherwise, they might advise you, or you're advised to apply through the ST3, ST3 posts directly. And then after the long listing is done, it's sort of done quite quickly usually. And then that's when the short listing is done. So this is when they look at your application and then they give you your application scores. And sorry, went forward by accident. So they look at your application, score it, and once they've scored everybody, they basically pick a number to have as the cutoff. So essentially, they have a maximum number of people they can interview. So they'll basically interview, they'll have their maximum number of people they can interview, and then however many people that is, they'll have a shortlisting sort of score, application score cutoff thing from there. And then your interviewing window is between February and March. And then throughout this time, you'll be given a preferencing. You can start preferencing from, I think, about January up until the day before offers are released. You're able to do your preferencing. And essentially, that's when you list in order what different sort of jobs or sort of deaneries that you would like to be considered for. And then in March, offers are released. And then you have the option of holding, upgrading, and accepting offers. I'll tell you guys a little bit more about that in a moment. So the offers process, essentially, as soon as the offers are given, is given based on national ranking, right? So every single person is given a score based on their application and their interview scores. They're then ranked nationally. And then what happens is whoever's ranked first in the country is then given their like first preference or first place they've ranked. Then whoever's ranked second is then given their first option. If their first option is already unavailable, they're given their second option. And then basically it goes down like that, essentially going down each until it gets to yourself. And then if your first or second or third options are not available, you'll be given the next one that is available, essentially. And this is towards the end of March. You then have 4 choices. You can either accept the offer, or you can accept with upgrades, which means that you've accepted the offer, and then sort of they will give it a couple of, I think, I can't remember exactly how long, maybe it's like a week or two, where if people either decline offers or decide not to take up their offer, that gets put back into the system, and automatically, if you've accepted and one that's available to you, that's an upgrade based on your personal ranking comes up, you'll be automatically given that job. The only thing with that, the only caveat with that would be to make sure that you've actually checked your rankings after you've done your accept with upgrades, because you have to be happy with whatever they give you, because they get, you lose what you had in the first place, if that makes sense. You automatically upgrade it to whichever post you get, and then you have to stick with that post. You can't say, no, I want the other one back, essentially. And then the other option you have is you can hold plus or minus with upgrades. So with holding, with the way specialty training applications work, you can apply for more than one specialty at a time, but you can only hold one offer at a time. So you can't like hold an offer for radiology and hold an offer for pediatrics. You can only hold one of them. And essentially, you only have 48 hours to decide what you're going to do, with your obviously your last option being to decline. Okay, so to get into the nitty-gritty of it, the application form. They've actually changed it quite recently. So previously, if you'd done any of the MRC PCH exams, you used to be able to get some extra points in the application form, but it looks like they've taken that out completely. So there's no application benefit of doing your pediatric exams early. Of course, if you want to do them, you can do them, but you won't get any application form benefit. Essentially, you get 2 possible marks for additional qualifications, depending on what they are. I'll show you exactly how you can look this up. You get 4 marks for transferable clinical skills. You get 4 marks for transferable clinical experience and reflection. You get 3 marks for sort of QI project audit. You get 3 marks for leadership and management, and then 4 marks for academic achievements. 4 marks for teaching, and then 6 marks for like your sort of why pediatrics question, essentially. And the way this works is, so that adds up to about 30 marks. So what happens is two pediatric consultants independently look at your application form and mark it by themselves. So each one marks you out of 30, and then both of their marks get added together to give you a score out of 60, just to sort of keep things quite fair. Now, as you can see from the application form, I'm going to show you guys the sort of the mark scheme in a moment, but essentially, they literally tell you what gives you marks. So if you've got enough time, you could potentially make sure that you get all 100% of the marks, because you could make sure that you've got appropriate clinical skills that are transferable. Now, this doesn't have to be in pediatrics. Same with the clinical experience and reflection. When I applied for my training post, I hadn't done a foundation job in pediatrics, so I didn't really have much experience in pediatrics to talk about at all. And I thought that might sort of hamper me. But I had about 1 week where I did a taster course, sort of taster week in peds, and I essentially just stretched the hell out of that. And I also just used other things I'd done in my other jobs. So, for example, in F1, I had done a ITU and anesthetics job, and I essentially used the fact that I was able to get good at certain practical skills like cannulation, or like or the fact that I'd done lots of things like intubation, PICC lines, etc., and then use that to make it relevant for pediatrics, and just to say something along the lines of I know it's useful for like a career in pediatrics, for doing things like lumbar punctures, which we do quite a lot of, and it's quite practical. There's lots of practical skills that we do in pediatrics. So just basically using my experience in something else to say that that would aid me in basically being a good pediatrician. So as long as you can, whatever you're using, as long as you can basically bring that over to how that would be helpful in a career in pediatrics, you can 100% use it and you'll get the marks. So that's your clinical skills and clinical experience. And then for QI audit, I think that's sort of quite straightforward. But if you haven't got anything, and like I kid you not, like I didn't really have much at all. Like that was not my strong point. That and research wasn't my strong point. But I basically, whatever I did have, I stretched it and tried to make it relevant to pediatrics and talked about it. But you've got, if you're planning to apply in November, you essentially have, and from now until November, you can definitely do a whole so audit or QI cycle and get that out of the way, and then use that. If you can get one that's relevant to pediatrics, great. If you can't, it's fine. Just get something done, and you'll be able to put that on your application answers. Same thing with the leadership and management. If you've not got anything, you can look into organizing something at where you're working at the minute, or doing like like a leadership course or something like that. Essentially, all of these things you can try and get things done for it now in order to get the marks then, because it's pretty black and white on what the marks will be for, right? Same thing with the teaching. You can do teaching like within your place of work at the minute, organize the bedside teaching, medical school teaching, whatever it may be. You could do like the teach the what's it called, the trainer course or something like that, teach the teacher course, something like that. Essentially, these are all things you can do. Another thing that I did for the clinical experience actually is I did like a 1 day acute pediatric illness course, illness management course, something like that, and I had like a certificate, etc. And I used the things I learned, like even though it was simulation and it wasn't like real life, like I used the things I learned as if it was real life, if that makes sense. So those are all things essentially you can do from now to actually make sure you can maximize the number of points you get from the application form. And then, yeah, statement of suitability. Again, if you go through the mark scheme, like it literally tells you the kind of person you need to be. So it is definitely all things that you can work towards now to maximize your scores. It's just about sort of starting from now, essentially. And then, so application tips. Yeah, so I think I've covered some of this already. But basically, start the white space answers early. Like, do not leave it for the last day. Like, I think when I actually counted up, because there's a word count. I'm trying to remember now, but I remember that the word count for the last question, the statement for suitability in a career in pediatrics, I remember that being about like, I don't know, was it like 600 characters, 600 words? I don't know if I'm being dramatic, but it was a lot. And I remember I wrote like, I think it was 600 words actually. I think I remember writing when I added up. everything I'd written for all the different questions. It added up to like 3,000 words, not characters, words. I'll check at the end. Remind me, ask me the question. But yeah, it actually added up to quite a lot of words, and obviously you want to read over it, make sure it makes sense, reads well, grammar, blah blah. So like, if you leave it for the last day, you won't be able to get something good out there. So start it early. Start working on the things that you need to put in there early as well. Start building your portfolio. And like, don't waste time. If this is definitely something you want to do and you want to maximize your scores, don't waste time doing things that won't give you points. So like, if you've got the choice between, I don't know, doing like a QI project, doing some teaching or something like that, or sitting your foundation of practice exam, do the QI project, because the exam's not going to get you any points, whereas the QI project will. Obviously, if you can do both, but essentially prioritize. So the two things you need to look for, well, which I will show you guys how to find on the RCPCH website, is the scoring framework. It is essentially a very, very detailed mark scheme on each white space question. Like, it speaks for itself. You can look through it and figure out and make a plan for yourself personally how you can maximize your scores. And then the person specification is quite helpful because it basically really goes into detail about what the essential and the desirable criteria are. So you can make sure that you've got all your essential criteria so that you pass the long listing stage. And then the desirable criteria is useful because it's useful for the application questions, and it's also useful for the interview questions because it's something that's assessed throughout the application process. Okay, now moving on to the interviews. So the way that the interviews work is basically it's an online interview, and it's essentially four sort of, I think they've split it up into two stations, but it's essentially four stations. And so one station is a communication station, which is role play, communication. I'll go into more detail in a moment. Second is reflective practice. Third is pediatric clinical reasoning question. And then fourth is the career motivation, which is like a virtual portfolio. It's not necessarily in this order, but it's just these are the four. So interview tips. Obviously, look at the desirable criteria, the essential and the desirable criteria, very useful. Look at the applicant guidance. So again, I'll show you there's a guidance, and it literally goes into real detail about what they expect from each sort of question or each category, or what they expect from you. It's all in there in black and white. I personally use the ISC medical interviews book. I find it quite helpful, not to sort of rehearse my answers completely, but in order to like have some sort of frameworks in mind when answering questions to make sure that I'm not just waffling on and just sort of just talking and not getting the things out there in a structured manner. I found that quite helpful, especially because you kind of know what sort of questions they can ask you based on what the category is. So for like the reflective practice, there's the whole like I've forgotten now. Was it called STAR? I can't remember. Check the book. But essentially, there's lots of different frameworks you can use to answer your questions, and you can also find ways to like practice some questions that you know will definitely come up. Time yourself, etc. Like practicing is extremely helpful. I would like spend a couple of weeks before your interview actually preparing and getting sort of ready for it. So if we go to each station, I can even tell you guys what I got in my interview because I thankfully remember it and I wrote it down. So in the communication station, essentially, it's normally an interaction with an actor who is either the child themselves or the patient, child patient slash the carer, parents or guardian. Essentially, it normally is you're either explaining a clinical condition or you're explaining a reasoning for a certain intervention or transfer, or you might be trying to persuade them to do something or get some information from them. And then the scoring framework, you basically, there's some negative and positive indicators. So I know previously, I remember once they did a case where you're speaking to like I think it was like a 15-year-old girl who was being admitted with an asthma exacerbation, and then she lets it known that she's been smoking, and you kind of have to like talk to her about that. and like she's like super concerned about things like, will you tell my parents? So like that's like a sort of negative positive indicator, because if you say like yes immediately, that's breaking patient confidentiality, but also like the positive way of saying it would be where you tell her, of course, things are confidential between you and her. However, you encourage her to tell her parents, or even suggest talking to them together. And then what I got from mine was I was talking to the mum of a 6-year-old who'd been admitted with anaphylaxis and was ready for discharge. And I had to basically discharge them with an EpiPen. And the mum was basically concerned about why we needed an EpiPen. And then we went to a whole lot basically that it wasn't just about the EpiPen. She was like just really anxious about this whole new diagnosis, etc., etc. So I had to sort of speak to her about that. Try to be empathetic. Try to actually find out what her. So it seemed in the beginning that it was the EpiPen that she was concerned about, but then sort of when you asked more questions and got in a bit deeper, there was actually other concerns that she also had. She didn't quite understand the diagnosis. Things hadn't been quite explained to her properly. Yeah, so that was my communication station. And then reflective practice. So essentially, what they ask you to do is to describe an event. What was your role on it? What was your role in particular, and how you reflected on it? And then how has this further developed your practice since then as a result? And like sort of how would you deal with sort of these feelings of all these things in the future? And then they also asked ways of using daily reflective practice, essentially, or how I use reflective practice in my sort of daily practice. So for this, top tip is describing the clinical event should not take you longer than, like, I don't know, if the whole station is 5 minutes, describing the actual event, the description should take you 30 seconds to a minute. Like, it's the most unimportant part. Like, what you're reflecting, what happened is unimportant. What's very important and you need to spend a lot of time on, is what your reflection was. So what you learned from it, why it was an important reflection, and then obviously how you have then used that reflection to feed into your clinical practice, how you've dealt with that situation in the future. And I think I'm trying to remember what I used, but I think what I used was there was like sort of a cardiac arrest, a really prolonged cardiac arrest on ITU when I was in F1, and I got asked to get involved. And I took sort of kind of a quite a like I took like a big role in it, but not so big where I didn't feel confident speaking up, because obviously I was just an F1 and I was surrounded by like consultants, registrars, and like, in intensive care, etc. But then because then I sort of reflected on the spot and decided, no, I need to like get involved in this. I spoke up and took charge of what my job was in that arrest situation, and then sort of what I then reflected on from that point onwards. And I think I got good feedback for that. So yeah, it's not about what the situation was, it's more about how you reflect and how you've then taken that practice on into the future. And then just moving on to clinical reasoning. So this was sort of like a case-based scenario. So essentially, I think I had like a 15-year-old who came in with like vomiting, abdo pain, lethargy, weight loss, and was sort of tachycardic, tachypneic, periphery shutdown, etc., etc. And blood glucose was 30. So obviously, I had to diagnose that this was a DKA, and then I was sort of asked what's my initial assessment, what's the diagnosis, what investigations and management would I like to do, and then I was asked what complication should I look out for. So this was cerebral edema. So what I would say for the clinical reasoning part is they don't expect you to have like in-depth knowledge of pediatrics. You're not meant to like have had previous experience, but you're meant to have had like no medical school level. So I would go over sort of all the acute presentations of illnesses, the things that you see quite often, your asthma exacerbations, your seizure management, your DKA management. Remember to be systematic, to you do your 8E approach, be clear in what you're sort of talking about, and also be aware of where you are. So who's around, what they say to you, where you are you in ED, what's around you, who can you ask for help. So for example, if you're in ED and you ask for your pediatric consultant and they're like, or your registrar, and they're like, oh, they're busy, or they're coming to you, or etc. You're in ED, remember there's other ED seniors. So like registrars or consultants that can help you. So making sure you call for help early and appropriately. And then they also asked me where I would want the patient to be moved to. So like understanding like DK is a sort of quite a serious illness, would need like HDU level care. And then I was asked to hand over to the consultant who had arrived. And then I was asked what I would say to Michelle and her mother, like when she was feeling a bit better. So it was only about a 10-minute station, but they did quite like ask you quite a bit. But I think they just expected you to know a little bit very well, essentially. So yeah, I would just go over those acute presentations, as I said, and just remember, like in pediatrics, you always escalate. Like there's never a time where you're expected to deal with something yourself, especially if it's something quite acute. Yeah, so that's the clinical reasoning. And then for the career motivation, so that's basically they asked me a couple of questions in this station. They asked me what was my biggest achievement personally. They asked me why I wanted to be a pediatrician, and they also asked me to tell them about one of my role models in medicine, what I admire about them, and how they will influence my practice as a pediatrician. So here's basically your opportunity to talk about your personal attributes and your achievements. So this is basically your portfolio station. So back in the day, they used to like actually physically go through your portfolio. That's not a thing anymore. But this is basically the one station you can fully prepare for and know what you're going to talk about. So pick your best attributes and achievements and get ready to talk about them, and always relate them to pediatrics. So don't talk about however amazing what it is. I don't know. I've been to the moon, right? Make that relevant to pediatrics. Whatever you talk about, make sure that the end of your answer is basically, and that would be helpful, or that will so useful in a career in pediatrics because of XYZ. And this is also sort of testing your understanding of pediatrics and what makes a good pediatrician. Think about like pick a role model. They might ask you that. I've heard that's quite a commonly asked question. And use your white application answers. Basically, the answers you use for your application can be quite helpful here. So the essential resource I was telling you about is on the RSPCH website. So I think what I'll do is, so the three things you need to look for is the applicant guidance, the person specification, the scoring framework, and then you watch out for the webinar that's always released on their YouTube, or you can watch it live in October. I think I can maybe switch. Can you guys, what screen can you see now? Has it changed to the RCPCH website?
Yeah, it's the RCPCH one.
Perfect. So when you go to the RCPCH website, if you just click on education and careers and you go to apply to pediatrics SD1 training or SD3, whichever is relevant for yourself, you then just scroll down. I mean, this whole page is really, really useful. So you can go through, you should probably go through the whole thing. But then if you scroll to the bottom, so this is the webinar I was telling you about. So this is the one they did in October 23. So there'll be a new one in October 24, which is more relevant to you. So then what's useful is the applicant guidance, the person specification, the scoring framework, and there's also like a recruitment timeline, which is helpful. So this is the applicant guidance. So for example, this is the bit about the online interview that tells you the format, the domains, it literally goes into each question and what they will assess and ask you for. And then it tells basically any question you might have, like this will like answer it essentially. It's got everything. And then here you've got your person specification, which is your essential criteria, which is this top bit here. So like fitness to practice, language skills, eligibility, etc. And then you've got your desirable criteria, so things that you can work towards, and how that's evaluated either in your application form or your interview selection, etc., etc. So that's helpful. And then this is the recruitment scoring framework that I was telling you about. So here literally it tells you get 1 mark for this, 2 for this. You get, in order to get maximum of 4 marks, for example, in clinical skills, you need more than 1 specific and significant example of clinical skills relevant specialty and own development clearly explained. So make sure you don't list lots of examples. They want you to have more than 1 that's specific and significant that you go into detail about. Yeah, so it's like essentially like really, really useful. And it can all be found on this page here. And that is everything. I think we might be doing questions at the end, so I'll just stop sharing for now. Thanks, guys.
Everyone. Thank you so much to everyone. And yeah, massive thanks to Huda as well. I think and it's been so many years since I've applied. So definitely and you guys are in good hands and yeah, inshallah it should be okay. I'm just gonna share my screen, inshallah, and then just give me just 1 second. Great. Can everyone see my screen? Perfect. Okay. No worries. I'll just make a start. So and I've got the slightly easier aspect of today actually because it involves talking about myself and talking about my experiences and just going through things actually. So inshallah, what I'm going to do is for the remaining 20 minutes or so, I'll just go through a little bit about life as a pediatric trainee, and then I'll also be there in the end as well, just to go through some questions and answers as well, inshallah. So with respects to me, I'm much older than probably most of you guys. So I graduated back in 2015 and I did F1 and F2 in East London and then actually afterwards I don't know what I was thinking, but I wanted to be a surgeon at some point. So then I spent 4 months working in at a major trauma center in London, then another 2 months and having a bit of a identity crisis as well. And I did a bit of locuming and tried to learn code and tried to leave medicine, but wasn't possible. And Alhamdulillah, in 2018, I got into pediatric training and I've been in pediatric training ever since. So with respects to my training, I was a South London trainee, but at the moment I'm a Pan London trainee. So I've worked at Kingston Hospital in my first year. I've worked in general pediatrics and neonates, and that was 6 months of each. And then for my ST2 and ST3, for that year and a half, I was at St. George's Hospital and I did general pediatrics, I did pediatric ID, and then I also did pediatric and ITU as well there as well, with some neonates as well. And then for my core registrar years, I worked at Croydon and Kingston. And in these core years, what I worked in was I did general pediatrics for 6 months. No, sorry, general pediatrics for a year, 6 months of neonates. And then I took a break and I worked as a research fellow at UCLH for a year. And that was really, really good because at that stage I felt like I was burning out and I needed a break from training. So alhamdulillah, that worked out really well. I got back into training September last year, and since then I've just been in training again. I finished off ST5 working at Evelina, and I did some community pediatrics there and general pediatrics, and then I did and I'm currently at the moment and doing my ST6 at St. Mary's and working in ITU again. So I think thinking about pediatric training, I think the main thing to do is to think about the good bits of it. And actually what I really, really like about the training is that I'm always surrounded by super supportive team members. And there's lots of opportunities for learning. And actually what I really like about pediatrics is that there's a massive diversity in presentation. And actually, even if we were to sort of take today as an example, so today I looked after a child who was post-op splenectomy. I looked after a child who had what did they have? I had a child who came in status epilepticus, and then there was a baby who had pertussis as well. So there's a lot of sort of learning and there's a lot of diversity in presentation, and actually there's a lot of variability in the cases that you see. And I think that's something that I find incredibly fulfilling. But also there's diversity in the whole community, the issues that face each community in which you rotate around. And I think that's the favorite thing about rotating across London. because there are different pockets of London that have different issues. And actually, an example is when I was, I was working in an affluent part of South London, and the children in that part generally came in more so with your psychosomatic symptoms, your low moods, your depressions, whereas a different aspect of London whereby there was poverty, you would see that children will be coming in because of gang violence, and there will be lots of safeguarding. So there's massive sort of variability in in what you see based on where you work. And I think that's the best thing about working in London and in any big city as well. Um, the other good thing was I actually felt it was probably the only job that I felt that I'm a valued member of the team. And I think it's people appreciate you being there, people appreciate you helping out, but also a really, really interesting aspect of pediatrics that most people are actually scared of, but I think is actually the best bit, is the opportunities that you have in honing in on your communication skills. So, there is, people are often scared about communicating with parents, but actually parents are the way I see it is that, we're all on the same team. And the way I see it is that, parents are very amenable to conversations, and actually parents are there to safeguard for their child, and you are also there to safeguard for their child as well. So being on the same team, sharing the same mental model often helps as well. And I think there are sort of little things that you can do with experience and with time that you learn how to sort of say something differently but have the same meaning. And I think that's very, I feel as if that's something that other specialties don't often have the opportunity for. But also the best thing about it is you're advocating for the child that's right in front of you. And I really feel like, pediatrics is probably, one of the very few jobs that are out there that's truly generalist in who you see and what you see. You can be taking care of a preterm baby all the way up to an 18-year-old, and sometimes even up to a 21-year-old, depending on where you work. And another aspect of pediatrics that I really like is pragmatic medicine. Like we're constantly questioning whether we need to do what we need to do, and what value does that add? What's the risk of doing what we need to do? And actually trying to constantly evaluate and think about those things are a really crucial aspect of the job. Now, the difficult bits are actually, it's there with every job that you do. And actually, other specialties are no more different to us. Every specialty has its own challenges, but I feel like some of the challenges that I think may are there from a pediatric point of view is more so from challenging families, and how do you mitigate that? How do you ensure that the child is safe, and how do you ensure that the child is achieving, the child is we're advocating for the child in the right way, and also another slightly challenging aspect of this is safeguarding as well. Now, safeguarding is a super, super crucial aspect of the job. But actually starting off, what would happen is that you get supported through it, but actually it's the safeguarding aspect of it that probably makes you a much better clinician. You're constantly thinking, you're constantly questioning, as in, okay, this is what the parent said, but actually, does it really make sense in terms of the mechanism? Is it really, if I were to imagine it and I were to sort of play out what they said as a movie, would it happen as they said? And I think that's the difficult bit, but also it can be the most fulfilling aspect of it as well. Now, with respect to sort of like typical shift patterns that you see within pediatrics, you can have long days, you can have nights, you can have short days, and you can also have twilights as well. So actually, it's pretty much similar to every other specialty. And a lot of people, I actually don't know why, but they feel like the rota is more heavier in pediatrics than any other specialty. And actually, to be fair, it's more or less the same. And it really depends on which hospital you work at, and it really depends on the staff level that you work at, in which hospital you work at. And actually, truly, I felt that, I felt more tired working on a general surgery jobs than I ever did with like pediatrics. And I actually think obs and gynae trainees have it way worse than we do. So it's not, I definitely wouldn't worry about the shifts at all. Now, if you're thinking about doing pediatrics, the question here is, okay, what can I do and how can I make sure that it is the one, it is the stuff for me, okay? And actually the next time you're at work, the most important thing to always do is look at the consultant and see how they are. Are they tired? Do they look, do they look, do they look fatigued? Do they look burnt out? What do they look like? Do they have like bags under their eyes? I mean, we all have bags under our eyes, but do they look like they're finished? Do they look like gaunt? As in, like, what are they looking like? And how do they behave? Do they feel stressed? Do they feel down? Do they hate their job? And I think these are the really interesting aspects of it that you can look at and sort of use to like determine whether or not it's a career for you as well. And every department generally has one consultant who's who generally is happy to talk to you more from a career aspect of it. So try and find that consultant and try and actually just take him for coffee and be like, yeah, why don't I buy you some coffee? I just wanted to ask you a bit about life as a consultant, and try and use that. But also look at senior registrars as well. Are they happy at their job? Do they feel fulfilled? As in, what do they hate about their job? What do they love about their job? And these are things that will give you a better glimpse of the specialty and would also help you make the right decision as well. And actually, the other important aspect is to think about you as a personality and you as an individual. As in, like, how do you work? Are you a slow process? Are you a type of person who deliberates over something? Are you the type of person who's go, 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 go? Are you the type of person who likes to collate a lot of information and make an informed decision? So I think it's really crucial to think about what type of personality you are. And actually, what's super interesting here is that I feel as if there are certain personalities for doing peds. And even if you go through pediatrics as a subspecialty, I think there are certain subspecialty personality traits that you have within pediatrics. So definitely think about who you are. Definitely think about how you see yourself. Definitely think about what's important to you and what are you willing to compromise on, or what are you not willing to compromise on. And the last thing is something, this doesn't actually exist. This is something that I just made up. But actually it really defines the crux of the issue that can sometimes be there. When you're deliberating over two things, and actually an example I'll give you is that I'll give you an example of me and before I started pediatric training. So this was back in 2018. So actually when I got an offer for pediatrics, I also got an offer for anesthetics as well at the time. Because I applied for it and alhamdulillah I got it. But I was really torn between doing pediatrics and doing anesthetics, and I didn't really know what to do. And actually, the issue that I had was I spent so much time thinking about what to choose. And actually, I realized at the end, actually, it doesn't really matter what I choose. The main thing is making a choice and going through with it. Because I know that, looking back now, I know that if I did anesthetics, I would have probably hated it and I would have quit and I would have applied for pediatrics. But also, it was very likely for me to do vice versa as well. So I think it's really important to not be scared of making a choice and being careful of being stuck in limbo because of like fear of choosing, and also just pushing ahead as well. And that's it. Sorry, I whistled through it. Only reason being is that I wanted to make sure that there was plenty of opportunities for questions, because we all have questions. And actually, mashallah, we've got a small group of people here. So we can actually, why don't I be mean? 1, 2, 3, 4, 5, 6. So why doesn't everyone just ask a question? We've got a really small group.